Hello, and welcome to this educational module on the early warning signs of postpartum complications, brought to you by the Philadelphia Department of Public Health's Maternal, Child, and Family Health Division. My name is Keisha Montgomery, Maternal Health RN Manager and Coordinator for the Philadelphia Maternal Mortality Review Committee. I'm here to guide you through this vital information to recognize potentially severe complications and save lives. Here are our learning objectives for this e-module. First, we'll define maternal mortality to understand the gravity of this issue and its impact on families. Second, we'll identify the early warning signs of potential health issues after childbirth. Awareness of these signs is a key step in prevention. Last, we will discuss the importance of early identification of these signs. Early action is not just beneficial, it's potentially life-saving, preventing serious postpartum complications and maternal mortality. By the end of this module, you will have a better understanding of these objectives, equipping you with the knowledge to recognize warning signs and make a positive impact on decreasing maternal mortality. So let's break down why this module is key for those of you on the front lines working with families in the city. First, it arms you with the knowledge to pass along to parents, knowledge that's crucial for them to recognize when they need medical attention after childbirth. Second, you'll sharpen your skills in spotting early warning signs. It's about being proactive, not reactive. Last, you're getting access to educational material that you can take back to the community to help improve health outcomes. So, what is maternal mortality? This term refers to a woman's death during or within a year after pregnancy due to pregnancy-related complications. Each time this happens, it's not only a loss for the family, but a wake-up call to society. It highlights the urgent need for the knowledge being shared in this module to help prevent these tragic deaths. So, why are we focused on the postpartum period? In Philadelphia, the reality of maternal mortality calls for attention. Data from our last MMRC report shows that 77% of pregnancy-related deaths occur after delivery. A significant concern is that nearly a quarter of these deaths happen after the first 6 weeks following delivery, a time when postpartum care often becomes less intensive. This highlights the crucial need for continued support and monitoring of maternal health well beyond the immediate postpartum period to ensure the well-being of birthing families in our community. So let's talk about the signs and symptoms of postpartum complications that you can look out for. So these are early warning signs of postpartum complications. The first one here is persistent headache. Sometimes the stress associated with the new changes of having a baby can cause people to explain the headache away. A persistent headache that does not resolve may not just be stress. It could be a sign of dangerously high blood pressure or preeclampsia. Changes in your vision. Changes in vision, such as seeing spots or experiencing limited vision, may indicate severe high blood pressure. Extreme swelling of your hands, face, or feet. Look for unusually puffy hands, face, or feet. If your shoes feel tighter or if there's sudden weight gain of 1 to 2 pounds in a day, it could be severe preeclampsia. Severe nausea and vomiting. Severe nausea and vomiting could be a red flag for high blood pressure as well, or a potential infection in the uterus, which if left untreated could lead to a life-threatening infection called sepsis. Seizures. Experiencing seizures is a serious matter and may be related to severe preeclampsia, known as eclampsia, which is high extreme blood pressure resulting in those seizures. Trouble breathing. Trouble breathing is never to be taken lightly and can be due to preeclampsia, a heart condition, or possible blood clot in the lungs. It's important to remember that while these symptoms can be signs of severe high blood pressure, they can also point to other health complications. No concern is too small to bring up with a healthcare provider. After all, the person experiencing these symptoms knows their body best. Here are additional postpartum warning signs to watch out for when coming into contact with birthing families. Chest pain. If someone is experiencing chest pain or it feels like their heart is racing, it could be a sign of several potential issues, such as severe blood loss, a blood clot in the lungs, or heart problems. Dizziness or fainting. Feeling dizzy or faint could mean there's significant blood loss, which needs immediate attention. Bleeding. Heavy bleeding, like soaking through a pad every hour, is a warning sign of possible severe bleeding and should not be ignored. Red swollen leg. A leg that's red, swollen, and painful to touch might indicate a deep vein thrombosis, which is a serious type of blood clot. Severe persistent belly pain. Persistent pain in the belly area could be due to an infection of the uterus lining, separation of an incision or wound, or internal bleeding. Fever. A fever of 100.4 or higher can signal an infection in the uterus or a widespread infection, which requires prompt medical attention. Last, rapid heartbeat. A normal heart rate range is between 60 and 100. If your resting heart rate exceeds 100 beats per minute or you're experiencing palpitations, seek medical attention. These symptoms are signs that something may not be right, and medical advice should be sought immediately. So you might be thinking, well, how am I going to remember everything we just learned in the last 2 slides? That's where the post-birth tool comes in. This tool was created by the Association of Women's Health, Obstetric, and Neonatal Nurses to help postpartum people, their families, and communities to help remember what to watch for. These can be ordered in the form of magnets and posters in several different languages. The post-birth warning signs are split into 2 sections. Call 911 and call your healthcare provider. Call 911 if you have P, pain in the chest, O, obstructed breathing or shortness of breath, S for seizures, and T for thoughts of hurting yourself or someone else. These are signs that you need to call 911 immediately. The birth portion below indicates signs and symptoms to call your health provider. B for bleeding that's soaking through 1 pad an hour or blood clots the size of an egg or bigger. I for incision that isn't healing. R for red or swollen leg, painful or warm to touch. T for temperature of 100.4 or higher. H for headache that does not get better even after taking medicine, or a headache with vision changes. If you cannot reach your healthcare provider, call 911 or go to an emergency room. These post-birth warning signs are a clear message. Don't wait, don't second guess. If you feel something isn't right, trust your instincts and act fast. And remember, when calling, mention that you just had a baby and describe the symptom. This helps healthcare providers give you the right care right away. Share with birthing families you come into contact with that taking care of a new life is important, but so is taking care of themselves. Keep this guide close. It could save their life. So how can you use the information that you learned here today? 1. You can request an early warning signs training, virtual or in person, for your staff that goes into a little bit more information about the early warning signs. 2. Request post-birth magnets and posters to give out to birthing families who have recently given birth. 3. Use what you learned today to empower birthing people to go back to their provider or hospital if they are having any of the signs and symptoms discussed today. Remember, no symptom is too small. Thank you for taking the time to watch this module. I hope you were able to take away some valuable information to share and prevent postpartum complications and maternal mortality. For any questions, to request an early warning signs training or request the post-birth magnets and posters, please contact me at the email address below.